Suspect a kidney problem if you have these signs and symptoms. You are welcome, ladies and gentlemen, to Dr. David Reproductive Health Channel. I am your midwife, your reproductive health expert. I am Dr. David. You're welcome. I am presenting to you some symptoms, some signs that you should observe for yourself. When you have them, please, you have to go to hospital. Even one of them presents is enough to suspect that you might be having a problem of the kidney. I want to say that the kidneys are organs that form urine. They are organs of excretion. They drain the waste product in the form of liquid from our body and then pass it down into the urinary bladder. And then when the bladder is full, you feel the sensation of urinating. You feel like you want to pee, you make urine, then you go and pee when your bladder is full. It's so nature has made this organ to remain healthy all the time. But this organ, in most cases, is also faced with risk, challenges that can cause them not function well. There are 2 kidneys in every man, right in at the back wall of the abdomen. That is why somebody, when he's feeling pain from the back, coming closer to the sides, then coming up as if to come nearer to the ribs, that angle, in most cases, pain from there indicates pain from the kidney or problems relating to the kidney. It is only in the hospital that further investigations can be made to confirm it. But the signs, the symptoms, you should be the one to notify. When a disease is discovered early, the outcome is better. The prognosis are fine. They are better, meaning it is easy to treat a problem that is not yet complicated. But they might be discovering a problem when it is late that has contaminated other organs, might have spread, might have complicated in a way that they start telling you that kidney is damaged, kidney is bad, I have to do transplant, I have to do this. Does it just happen as an acute problem? Not so, and not in most cases. You can take note of certain signs. I want us to note that the major signs will have to do with the same urine that you go and urinate. Most of the time, please observe, watch your urine. When you pee, look at it. There are certain changes that may involve the urine. Urine may change in quantity. That sometimes you may note that you are urinating too much. The quantity is high. Or you are urinating frequently. Many times in a day, especially in the night. It's an indication of a problem. The hospital will help you. Your doctor will help you identify what the problem is. The earlier, the better. There could be blood in the urine. So when you urinate and notice blood inside your urine, it's a sign of a problem. The urine could be foaming. That you could pee. A lot of men have this problem. You stand somewhere and pee, and then your urine is foaming. It foam as if there is savon, there is soap inside. Question mark. When it foams much, why is my urine foaming? Your doctor will tell you better. Now, there are certain signs that will involve swelling of certain parts of the body, what we call edema. And it could involve the hands, it could involve the feet. In some people, it even involves the face. You just see somebody puffing up, especially in the feet, in the legs, swelling on the ground. You come back and see your father or your mother, legs swelling, and even hands, sometimes even face. She just looks puffy. It doesn't ring a bell. Please let it ring a bell. You take her to the hospital, or you take yourself to the hospital and see your doctor. In most cases, it's indicating problem with the kidney because of now a lot of accumulation of fluid or a lot of water retention in the body. You will find such edema. Now, what are some of those symptoms? That when you are having them, please suspect the kidney problem. And then you have to quickly go to hospital for confirmation and treatment. Nausea. If you always feel like to vomit, even if you don't vomit, please check yourself. Vomiting itself, loss of appetite, fatigue, weakness. You know, there are sometimes that some people just feel tired and doubt what is happening to them. And they feel weak. They feel like they can just lie down and be sleeping. Please, with that, you have to go to the hospital. There is what we also call insomnia. Insomnia is sleeplessness. You know, problems, sleep pattern problems. There are some people when they go to bed, it looks like their sleep is dry. Any small rat that passes over the ceiling, they hear. Any small cockroach, mosquito, they hear. What happens outside, they hear. You cannot sleep. Is it normal that you cannot even sleep? That problem of sleeplessness is indicating something. You may be urinating much or less. Somebody may also note that he has gone for a whole day without even urinating, even 2 days without urinating. It's a problem. It's signals, because when you urinate too frequent, it's a problem. When you don't equally urinate normally, it's a problem. My dear brothers and sisters, it goes as far as loss of memory. You may find a young man still 40, 50, 60, and is already complaining of forgetfulness. You know, he easily forgets. A lot of things he cannot remember. Something is not going well in the system, and it might involve the kidney. Muscle cramps. Sometimes you see some people keep hitting their leg, bap, 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 bap. Hit this part, that cramp, especially in the legs, in the lower, starting from the laps, you know, right from the groin, coming down to the laps. They will complain a lot of cramps, muscle cramps. Please go and check yourself. See your doctor. Give these complaints. They might even just be some things that are lacking in your body. If you have not yet subscribed to this channel, please do, so that you are part of us all the time. Subscribe, like, and share. Then you can make your comment on the comment section. You can always call too, anytime. If you wish that you can talk with me one-on-one. I always also give the WhatsApp number. That is +237 694 353141. I am here in Cameroon, precisely in Bamenda, Darinkum. Thank you. Bye-bye.